Hey folks, welcome back to the Brown Surgery Podcast. I'm your host, Dr. Kenneth Lynch. In this episode, we're going to continue our look into career decision-making within surgical subspecialties. Today, we're going to dive into the world of vascular surgery. We're going to take a look at what a day in the life looks like, some of the factors that go into choosing a vascular fellowship, address some of the misconceptions about vascular surgery, and of course, touch on the often discussed work-life balance. Joining me to discuss this topic is one of our vascular surgeons, Dr. Carla Moreira. Dr. Moreira is an assistant professor of surgery here at Brown. She graduated from Rhode Island College with a BA in biology and chemistry. She later received her MD from Alpert Medical School at Brown University and completed her residency in general surgery at the University of Chicago. This was followed by a 2-year fellowship in vascular and endovascular surgery at Boston Medical Center. In addition to being one of our vascular surgeons on staff here, Dr. Moreira also serves as one of our associate program directors for the Brown Surgical Residency. All right, so I'd like to welcome Dr. Carla Moreira to the podcast today.
Thank you, Dr. Kenny Lynch, for having me.
So Carla, it's nice to hear why folks chose a particular profession or discipline within surgery. So I really wanted to have you on today to hear about why you chose this particular career and what were some of the deciding factors that led you down the path to becoming a vascular surgeon.
Of course. I chose surgery because it was the best way that I could be of service, meaning that I wanted to be, the best doctor that could help the most people. And I realized that, my misconception, I think, when I came into medical school, that surgeons and doctors somehow were different. That, you were either a surgeon, and that meant, you just cut things and did operations and whatever that was, or you were a doctor and you took care of patients. Boy, was I wrong. I realized very early on, through exposure to general surgery residents at Brown, that they were just the most amazing, well-trained, well-rounded doctors. And then they got to do this incredible thing, which is when they saw a problem, they could, take the patient to the operating room and actually fix it. And that was such an incredible revelation and such a incredible access to see that you could be an impact and serve in that capacity. Dr. Chaffee was the chair back then when I was a medical student. And I remember this kind of crystallized my decision to go into surgery. We were in George Auditorium. I don't remember if it was after a grand round or an M&M, but he got up and he was talking about what it meant to be a surgical resident, what it meant to be a surgeon. And he said something to this effect, surgeon is the conscience of the hospital. And that to me was really crystallized. I'm like, that's who I want to be. I want to have the skills and the ability to do the right thing for the patient, whatever that was, no matter the situation. So that's ultimately what, I wanted to go into surgery.
And then you did your first 2 years of surgery here at Brown with us and finished up at the University of Chicago.
Yes. So I decided on surgery. Surgery was the last rotation that I did because, again, like I said, my misconception was that I was going to be a doctor and not a surgeon. And when I did surgery and I completely fell in love with and realized that was what I wanted to do, I applied and I didn't match. And that was such a punch in the gut. And that was a turning point, at least for me, in the sense that, like, at that moment, you can either say, that's fine, I probably should do something else, or you can double down and say, this is the only thing I want to do with my life. And I'm going to, my path into surgery may not be the straight line in terms of matching right away, but I'm going to be a surgeon. So I was lucky enough to stay here at Brown for 2 years. Then I got a categorical position at University of Chicago, where I finished my general surgery training. And so having maybe not the straight or the road well traveled, it just for me solidified and made it clear that I made the right decision, that, surgery was my passion and my love, and that I would do everything and anything to accomplish that goal.
At what point did you realize that you wanted to become a vascular surgeon, and what went into that?
Oh, yes. So I remember being an intern. Vascular surgery was the first rotation that I did. And I, at that point, was like, no way, no how, this is crazy. All the patients are super sick. The service is super busy. As an intern, you're just running around. You feel like a chicken with your head cut off. You're doing a lot of dressing changes. You're putting in a lot of medication orders. You're dealing with, patients post-operatively trying to, have complications, have heart attack. I felt like it was an introduction into a complex, high acuity patient population that as an intern, I was just like, there's no way I'm doing this. Please, and I actually told someone, if I ever say I want to go into vascular surgery, you have the right to restrain me until I come to my senses. But I did surgery again as a second year. And as a second year, at least here at Brown in our program, you do a lot of fistula. So you become the fistula fellow and you work with the transplant surgeon, so Dr. Morrissey, and doing a lot of anastomosis. So, beyond my first year, I really liked doing procedures, liked working with my hands, liked being in the OR. Obviously, that's why I went into general surgery. But, doing the fistulas, it was so intricate and it was so delicate. And, the cases were, kind of straightforward enough. But the impact that a fistula has on a patient's life, it's life-saving, it's their lifeline. So got a lot of satisfaction from that. I really loved fistula work and, love it to this day. And that was, again, thanks to Dr. Morrissey. And that was my first introduction to kind of vascular anastomosis and the kind of precision and the planning and the thinking and all of those. So that was my first kind of inkling that like, hey, maybe I might like this. Ultimately, why I decided to go into vascular surgery is I liked the longitudinal aspect of the relationship that you have with your patients. For the most part, you get exposure to all of the different surgical subspecialties. And I enjoyed all of them, but I really wanted to be in a field again where I would be able to have a patient and that patient would be your patient for, potentially for life, either the rest of their life or the rest of your life. So that opportunity, there's a few surgical subspecialty where you get to maintain that kind of longitudinal relationship, and vascular was certainly one of those. I really liked that kind of partnership that you have with the patient, and you build a long-term relationship with them, with their family, with their other physician. The other aspect too about vascular surgery that really, initially thrilled me was the variety, just the skill set that you have. It's just in terms of talk about being well trained, open vascular procedures. The first time I did a, retroperitoneal approach for abdominal aortic aneurysm, I was hooked. The anatomy, the dissection, the skill, just having to plan that case and think about and the patient selection, all of those things. It just brought all of this creativity, but also application to evidence-based, attention to details, to anatomy. I was like, why would anybody do this differently? And, why would anybody do anything else other than this case, And, obviously there's reasons why, retroperitoneal AAA or aneurysm repair is not a good option for everybody. But I love that aspect that you have the skill and the ability to one day be doing fistula, where it's the small, you're using, 6-0, in some cases 7-0 Prolene to make, the tiniest anastomosis that you're ever going to make. And then even the same day or the next day, you're doing a retroperitoneal, abdominal aortic aneurysm repair. And then that's not even talking about the endovascular aspect of it, which is a completely different skill set, a completely different way to plan and think, and you're interacting with, different type of technology and so forth. So clearly, maybe from what you can tell, I like to be busy. I like to never be bored, in the sense of I want my days to be different, to bring different challenges. I want to be thinking about different things. So I think if you are that kind of person that you want to, be on your toes and you want to have a variety to your day and to your practice, vascular is a very attractive field for all of those reasons. And certainly those are the things that attracted me to vascular. And to this day, those are the reasons that I still love vascular surgery.
I think that's a great segue into Fast forwarding to your life now, what does a normal work week look like for you between the OR, your clinic requirements, your service requirements? I mean, is there ever a normal week?
There is not we try to get into a routine as much as possible. I think, in terms of there is a calmness or there's an order in the middle of the chaos. But for example, Mondays are my typical block days, my OR days, where I would do most of my kind of bigger cases, angios, and I would have multiple cases. Tuesday, I split my day since becoming the social program director, needing time to be able to do some of that, administrative and some of that work. So half the day I spend doing just kind of the administrative aspect of that job and meeting with, residents and so forth. Tuesday afternoon, I am also the section chief for vascular surgery at the Providence VA. So Tuesday afternoon, I'm usually there at the VA for administrative work as well as reviewing vascular lab studies there. Wednesdays tend to be my free floating days where I either have clinic or I have OR, and those are the days that I might have lighter cases in the OR, or if I'm in clinic, I'm seeing patients and I'm doing vein procedures or other office-based procedures like temporary biopsies and wound care and things like that. Thursdays, I'm in clinic, essentially vascular clinic at the VA all day. So that means I see all kinds of patients with all kinds of vascular pathology. So on the normal, typical Thursday at the VA, we usually see between 15 to 20 plus patients in the morning, and in the afternoon we can see even up to 40 patients. So there's a lot of patient encounters. And then Fridays, in clinic all day at Rhode Island, where it's my kind of busy private practice kind of office. Again, general vascular practice. So I'm seeing all different patients with all different vascular pathology. We do wound care in the office as well, and as well as vein procedures and other procedures in the office. That schedule may seem hectic to most, but to me, there is a consistency there. But don't be scared by that, because there's ways to scale up or scale down your practice depending on your personal interest and where you are in terms of your career, and in general, also what kind of practice you go into, whether it's academic versus more private practice. And we're very busy here, but you can be in a smaller hospital setting as well.
So the students and residents who are listening to you right now, and you've got them hooked now, they're like, wow, yeah, I can see myself doing vascular surgery. What advice would you give them if they're considering vascular as a career?
I think, if you're considering vascular, but if you're considering surgery, one of the biggest things that I tell, medical students in particular, go into every rotation, expose yourself with an open mind. Your first goal is to be the best doctor you can be, because that's what a surgeon is. The surgeon is the most well-trained doctor that pays attention to the entire patient. So that means that every rotation that you're on, every subspecialty that you rotate on, from psych to family medicine to internal medicine, you want to learn as much as you can. And then if the decision is to go into surgery and ultimately to go into vascular surgery, I think you have to be mature in the sense that it's quite exciting. The skill set and the tools that you will be exposed to is great. But ultimately, I think you have to, what attracted me in the first place, that longitudinal care aspect, the way that you approach, vascular patients for the most part tend to be, vascular disease in general is a disease of the elderly. So a lot of the patient that you'll be interacting with will be older with lots of other medical comorbidities. So you have to be comfortable in dealing with that patient population. You have to be comfortable in dealing with complex medical issues, and you have to be comfortable also in working in teams, in the sense that it's a multidisciplinary approach. I spend a lot of times talking with my patients, but I also spend a lot of times coordinating the care of my patients with their primary care doctors, with their cardiologists, with other surgeons. And that's the thing about vascular surgery, is because your tool kit or your training and your skill set is so wide that you will end up interacting with all types of different doctors and other surgical subspecialties. So if you're comfortable doing that, then vascular is for you. The first thing is to be exposed early. So if you're a medical student, try to get exposure early. I currently have multiple, I have some pre-med students that are shadowing me in the office. I also have a few first year and second year medical students who are shadowing me in the office because they want to get that early exposure. And I think that's great. So wherever you can get exposure, that's fantastic. Now for the residents, once you make that decision, or even if you're a medical student and you make that decision that you want to go into vascular surgery, I think depending on where you are here, we have 4 vascular surgeons, actually 5 vascular surgeons here at Rhode Island Hospital and the Miriam Hospital that you can have mentorship and again exposure in the sense of the nuances in the conversation and how we think and approach our career and how we think and approach patient care and so forth. If you can start talking with vascular surgeon that you work with as early as possible, come to their office and see how they manage the office, what kind of patients they see in the office, and what kind of conversations they're having with those patients. Certainly, I may see about 100 patients between my office from the VA to my private office at Rhode Island Hospital in a week, but of those, in terms of operating, less than 10%, of those patients are going to the operating room. So a lot of it is patient management, managing chronic disease. But when we do operate, the operations are varied and they are interesting and they're fun and exhausting, but I love it.
So I think this is another good segue into talking about some fellowship options for vascular surgery. There's a lot of vascular fellowships out there that exist. If our residents are thinking that, what should they be looking for in a vascular fellowship program?
Yes. So again, speaking broadly about the options in terms of going into doing a vascular surgery residency or fellowship. For a long time, vascular surgery was what we, in terms of vascular surgery, open vascular procedure was performed by general surgeons. The ability to then subspecialize and for vascular to be its own subspecialty, that came about not too long ago, really within the last 25 to 30 years. And so the traditional route was 5 years of general surgery training and then 2 years of additional vascular surgery training, with more recently the option to do vascular residency programs. The last I checked, I think these numbers are from 2016, 2017. There were about 48 programs around the country which were integrated, so 0 and 5 vascular residency. Those are programs that accept residents, right out of medical school. So if you're a medical student that you are interested in vascular surgery, you know for a fact that that's all you want to be. You had the exposure, you've done your homework, and you want to become a vascular surgeon. That is a pathway where you match into one of these 48 plus probably program, and you spend, their first 3 years, you're integrated with the general surgery program, and you're spending probably half your year, 6 months, doing core surgical training, again, in terms of what a typical general surgery resident would be doing. And then you're spending the other half doing core vascular surgery training. And then really in the last probably 2 years of your training, then you're just focused just on vascular surgery. There are very few programs out there called early specialization program that allows you to do, general surgery for 4 years and then do a vascular surgery for 2 additional years in terms of subspecialization. The big difference between the traditional, 5+2 fellowship route and the vascular integrated or vascular residency program is that for the integrated programs, you do not sit for the general surgery board. So you would only be qualified to sit for the vascular surgery board.
Yeah, I think we've seen this with urology, plastic
Yes.
surgery. I do think this is going to be the trend.
Yes.
Where in 5 years or 10 years, the only option, if you want to do vascular surgery, you're going to go right in after medical school and do an integrated.
Probably a lot. So the programs that, as I mentioned, the last I checked, there were about 48 to 50 programs across the country that were offering the integrated ON5 pathway. What a lot of programs did is that they started their residency program, waited a couple of years, and then phased out their fellowship program. So there's still more fellowship spots available than there are integrated programs available. But we've seen throughout the year that, they're almost, kind of equalizing. And I do think that the trend is that most programs are going to phase out their 5 and 2. And that's going to be, less common pathway or route for people to get into vascular surgery.
For those doing the traditional route, 5 years of general surgery, and then are seeking to get into a vascular fellowship, any suggestions for those residents in terms of what they should look for in their 2-year program?
So I'm biased. I loved my general surgery training. I really think that it informs my vascular practice quite a bit. I think that a general surgeon, thinking and spending that 5 years to really hone that skill was formative for me and important for me. But I think that the integrated programs are doing quite a good job of that anyways. For the residents that are thinking about vascular that are currently in general surgery programs, again, I think what you want to look for is a program that is well-rounded. That is going to give you, exposure to open surgical techniques, open aneurysms, open bypass procedures, even access, the bread and butter vascular surgery procedures, hemodialysis access, open exposure. And that's actually a little bit of a shift in the trend that we see as endovascular options for treatment of almost all vascular pathology has really become almost a standard. When I was looking for a fellowship program, is you wanted to look for the number of endovascular. So you wanted to go somewhere where you had exposure to high end, a heavy room, and you're doing kind of high end, complex aortic and endovascular procedures. Now, the trend is you want to be exposed to open vascular technique. And I think especially for the newer residents or the current residents that you may not, even in general surgery, have as much exposure to large open surgical procedures, exposing the aorta in a trauma or exposing to the retrohepatic, vena cava or something that hopefully you're not doing that a lot, but just the opportunity to do those big, major open surgical procedures are becoming, less and less, even in general surgery, for general surgery trainees, as well as for vascular surgery trainees. And I think the fear is that you still need to have those skills. You still need to be able to do those procedures because we all know that endovascular grafts get infected, endovascular stents fail, and there comes a time where a knife is what you need. So my biggest advice for general surgery residents who are looking for a fellowship program is, depending on your exposure and your comfort to major open surgical techniques, you want to find a program that will give you that. And again, it might be counterintuitive because of the move towards endovascular techniques. So you will get the endovascular option. You also want to go somewhere probably that gives you exposure to research. And even if you're not planning to do basic science research, I think you still want to be comfortable with, outcomes research. You want to be comfortable looking at, big data. You want to be comfortable even in terms of applying quality improvement and have that skill set to your practice in terms of how you incorporate it into your practice. And, health disparities exist in every aspect of surgical and medical care, but particularly in vascular surgery patients. And that's an area that I think all vascular surgeons should be comfortable in terms of addressing. So those are the two things that I will look for in terms of looking for a fellowship program.
Yeah, I think it's a great point you brought up, especially with the movement towards endovascular versus open procedures. Are there any other misconceptions about vascular surgery that you might want to address?
Oh, yes. I mean, I think that despite us being a subspecialty and having our own kind of board certification, that there's still I think the general public out there still doesn't know what a vascular surgeon is. I still have patients that think that I'm a cardiac surgeon, and they hear vascular and they kind of immediately think of the heart for whatever reason. Also, I have, primary care physicians that will send me patients for, veins, and they're like, "Oh, do you know somebody that I can send this patient with who has a, carotid disease or carotid stenosis?" So I think that there is still a lot that we, as in terms of vascular surgery society, can do to educate the public in terms of what we do, and also the fact that we do open surgery. There is this misconception that vascular surgeon just does open vascular surgery, and that if you need endovascular treatment or options, then you send them to an interventionalist, like either interventional cardiology or interventional radiology. So their misconceptions still exist, even among medical students if they don't have the early exposure, and even practitioners out in the community, and especially for my patients. So we work on all over the body. I think that's the other thing too. Vascular surgeons work on every blood vessel outside of the brain and the heart. I think it's because of the complexity and the breadth of what we do as vascular surgeons that a lot of people don't realize that there is a specialty out there that can do it all, and that's vascular surgeons, the most well-trained, comprehensive, well-rounded specialty out there. That's a hill I will die on, and I will fight you for it.
Well said. I've got one more question for you. You've talked about, and you are a successful, productive, well-trained vascular surgeon, right? But you're also a successful wife, mother. How do you balance work with life? We quibble about if that can actually exist, work-life balance, but tell me how Dr. Moreira does it.
I don't. That's the honest answer. I think we have to be honest about these things, that I am passionate. Hopefully that came through about what I do. I would do it again. And I feel like I have to do it the way that I do it, in the sense of I kind of give my all to my patients, and I want to give my all to my residents and the students, and in terms of inspiring them to pursue this career that I love and I think impacts people's lives in such a positive way. But I also want to give my all to my husband and to my family. And so what I say is, what does balance mean? Balance means that you have to prioritize and you make choices, and every single day there is a choice that I make. What time I leave the house, the days that I have surgery and I have to be in the office at a certain time or in the OR a certain time. If I have an opportunity to be home early, I'll make that choice in terms of being home early. If there are days where, I have the option or the choice to drop off my kid at school and start my clinic later, I will make that choice. If I have the ability to leave and do my notes at home, I might do that. Or don't bring any work home. I often do this where I bring work home, but I don't do whatever work that I thought I was going to do, because I made the decision that I'm going to spend that time with my family. So you're making those choices and you're prioritizing every single day and day to day. And in the end, it hopefully does balance out. And that's what, for me, balance is. It's not giving 100% of my time every single day to vascular or every single day to my family and so forth. And it's a give and take. And I'm still trying to get better at it. Certainly, it's a skill that we all need to, work on every single day. And the thing that helps, I have good partners. I forgot to mention, I should definitely mention this to residents that are interested and that are, either already applying for fellowship or that are finishing fellowships and are looking for their first job, is you want to go to a place where you have good partners. because vascular surgery, it's exciting, it's amazing, it's fun, but it's also difficult. And you want to have good partners, good mentors to help you make those decisions. So in every aspect of the way, mentorship is incredibly important. So for me, part of that balance is being in a practice with good partners that help me make good decisions at work so that when I go home, I can be with my family. Those are the things that I love about vascular surgery. And I'll leave with this. There used to be a saying that vascular surgeons were the firemen or fire person to the OR, because that meant that, we would come when somebody needed help and we had the skill set to be able to get people out of trouble. The more modern saying is the vascular surgeon is the surgeon's surgeon. And that's because, again, our skill set and breadth of our knowledge and our tools that we have available to us allows us to work and bail out every single specialty out there. I think we work with trauma surgeons, we work with general surgeons, we work with cardiac thoracic surgeons, we work with orthopedic surgeons, we work with cardiologists, we work with every single specialty out there, and we are able to help them and be able to bail them out. And in some ways that is also very satisfying. Not the only reason, but it's satisfying to know that you have a skill set that can help your colleagues. So,
Carla, thanks for coming on and sharing your career journey with us today. These career decisions are important ones, and our students and residents are making them every day. Thank you for being, such an advocate for vascular surgery and a mentor to our students and residents, and a great vascular surgeon for our community.
Thank you, Dr. Lynch. And again, if residents or students have any other questions, so vascular.org is the website for the Society for Vascular Surgery. And in there's so much information that can help you as a resident in terms of making a decision about residency, but fellowship. And then for students, there are multiple regional scholarships and other mentorship tools available. So follow up with them, but also call me, contact me. My cell phone number is well known, and my email. So I get cold emails and cold texts all the time, and I do respond to them.
I can link all of that information to this podcast. So thanks again, Dr. Moreira.
Thank you. This has been a pleasure.
So thanks again to Dr. Moreira for joining me today to discuss her career decision-making and what a day in her life looks like as a vascular surgeon. I will link Dr. Moreira's email address below if folks have comments or questions for her regarding vascular surgery or anything she spoke about in today's episode. I will also link the website vascular.org in the description. Thanks for supporting Brown Surgery Podcast. We have a bunch of great content lined up in the current months, including our current Fellows and Chief Resident podcast project, where we will cover topics such as mucinous appendiceal masses and global surgery research, to name a few. If there are specific topics and or specialties you would like me to dive into in this podcast, please email me. My email will be in the description. Have a great week, and I'm looking forward to having you back with us in the next episode of the Brown Surgery Podcast.